everyone, this lecture video is under the topic sound and hearing, and this lecture is all about the hearing loss and the correction of that. First, we have here the causes. So the hearing loss has many causes, and the most common is that being aged, in which there is a deterioration in the physical parts of the ear. And second, we have here the trauma from sudden injury, prolonged exposure to high sound levels, disease, and congenital birth defects. There are two basic types of hearing loss. First, we have here the conductive hearing loss and the neural hearing loss. The conductive hearing loss is caused by defects in the structures that conduct sound to the inner ear. Another type of hearing loss is the neural hearing loss. From the term neural, this is all about the senses and the neurons. So, we have here the sensory neural. The neural hearing loss results from damage to the cochlea or the neurons, because we have here the cochlea, it has 30,000 neurons, right? So if there is a damage on the neurons will have damage in terms of sensitivity. So this type of hearing loss is very difficult to correct. Let us have here the types of hearing loss more. For conductive, we have here in terms of fluid, foreign objects such as cotton buds, fluid such as liquids, eardrops, such as you are in too much water when you are swimming, allergies, ruptured eardrums, okay, from the foreign objects since you are poking on it too much with cotton buds. Then the impacted earwax. For example, you damage your earwax. Then we also have here for sensory neural, the aging. The aging causes the deterioration of the neurons, noise damage, then drug side effects. When you have a drug side effects, it will affect your neurons, the transmission of the sound. Auditory tumors, the cells that has damaged cells. Then blast or explosion, because that consists of too much noise, the explosion. It will have a great impact on your ears. And the things that they are common is that sometimes the sensory neural and conductive can be a genetic disorder. It can be an infection from the bacteria because it can damage the neurons when it is in bacterial form. And it can also damage the ear canal when it is in bacterial form as well. Head trauma, when you bump your head, okay, that can cause sensory neural hearing loss and conductive hearing loss. So what are the measures to prevent this? First, you have to undergo hearing tests. So the most common method is that placing the patient in a soundproof room, and the doctors will ask him or her to signal when a sound becomes audible or when he or she can hear the sound that is being played. So both of the ears is being tested individually using a headset. Then the frequency that has been heard by the patient is being recorded in an audiogram. The audiogram is the graph for the hearing test of frequencies of the patient. After that, after it has been proven that the ear has a problem, the patient will proceed on the bone conduction test. So here in bone conduction test, a probe is placed around the skull, behind the ear, and sound vibrations of various frequencies and intensities are sent to the inner ear. The bone conduction test bypasses the outer and the middle ear structures. If hearing is significantly better by bone conduction, then the hearing loss is conductive rather than neural. So this is one of the tests that identifies whether your hearing loss is conductive or neural. So after testing, the doctor will recommend some devices that the patient may use, and one of the common is the use of hearing aids for elderly and for children experiencing hearing defects that was inborn. So it is important to take care of our ears properly, clean it properly, softly, use soft cotton buds, and avoid too much exposure in loud noise and being too much underwater. So that is all for this lecture in hearing loss and corrections.